We did not want people to keep dying. And so we took this action to try to equip those who were most vulnerable, susceptible.
So in the early days of the COVID-19 pandemic, state lawmakers formed the Michigan Coronavirus Task Force on Racial Disparities. At a press conference at Wayne State University on Monday, Lieutenant Governor Garlin Gilchrist announced actions taken in 2020 and 2022 resulted in positive outcomes.
These mobile health units, that was a Michigan invention and innovation. What that was about is something that our chief medical executive at the time, Dr. Jonae Caldoun, would describe as the best public health being health that you take to the public.
Gilchrist says the task force and its work inspired others across the country.
The state of Maryland has enacted specific work based on our work in their urban communities. The state of Colorado has enacted specific work based on what they learned from us in Michigan and their indigenous and tribal nations.
And while there is still work to be done, members of the task force say they have seen improvements in racial disparities when it comes to health care.
With COVID-19, the data speaks for itself. The outcomes we saw in that first wave were startling. And with every subsequent wave of COVID, we were able to reduce those healthcare disparities and those disparities in outcomes.
The biggest takeaway that I had from this experience is that we can make progress when we try.
We are not saying that race is a risk factor. This is not about blaming a particular community. Quite candidly, race is not the risk factor. Racism is the risk factor. And the reason why communities of color, people of color, tend to be underemployed or housed in more vulnerable communities is because of sort of the historical consequences.
In Detroit, Camila Mary, Fox 2 News.